Hello everyone, this is Sharmia. In this video, I am going to teach about types and legal requirements of prescription. First of all, types of prescription. It includes 5 types: simple prescription, compounded prescription, e-prescription, which means electronic prescription, inpatient prescription, and at last, narcotic prescriptions. First is simple prescription. Simple prescription means it's a non-compounded prescription. Already pre-compounded drugs has to be written by the prescriber and supplied by the pharmacist to the patient. Next one is compounded prescription. Compounded prescription means the prescriber must write what are the materials has to be compounded. First of all, base. Base is the main active ingredient. How many doses of the base has to be added? The prescriber must written a note. Next one is additives. Additives means which are used to improve the activity of the active ingredient. In which ml we have to add the additives. The prescriber has to be denote this. Third is vehicle. Vehicle means syrup, emulsion, suspension. These are the vehicles in which the active ingredients and additives is mixed. To make up the volume, the vehicle is used. This is a non-compounding this is a compounded prescription. The first one is a simple prescription, non-compounded. This one is compounded. We have to compound the medication and then dispense to the patient. Third one is e-prescription, electronic prescription. This prescription is used to avoid the errors. Misuse and errors are prevented by using the electronic prescription. In this, the prescriber use the computers to transfer the prescription. In this, the prescriber will type the prescription in the computer and he will transfer this to the pharmacy. Directly to the pharmacy computer, so that misuse and errors are prevented by using the electronic prescription. Next one is inpatient prescription. Inpatient prescription means which are used in the patients who are admitted in the hospitals. This are used during the infectious disease cases, cardiac care, pediatric and other conditions. We can use inpatient prescription because of using specialized units. Last one is narcotic prescription. Narcotic prescription, for the why we have a separate narcotic prescription means we have to mention the specific address of the patient and narcotic registry number of the prescriber, so that we can easily identify who prescribed this narcotic drugs. Then this will prevent the misuse of the drug also, and this will control the more dispensing of the narcotic drugs. Next one is legal requirements for the valid prescription. A prescription has to be taken as a valid if this 10 requirements is fulfilled. First of all, the prescription has to be written in unerased ink. Then a prescription has to be signed by the medical practitioner. Then prescription must have a date of prescribing date, then address of the prescriber. Then if the dentist written a prescription means it should be mentioned that as dental use only. Then always the prescription has to be written legibly. Next one, prescription always use space out words and numbers to avoid confusions. We should always complete all the medication orders try to complete all medication orders in one prescription, and we should avoid abbreviations in the prescription. Nowadays, electronic prescriptions are widely used to minimize the medication errors. Then the use of the Latin word RX symbol it's one of the traditional, so we have to use that RX symbol, which means God of healing in Greek word, or it also denote you can take the medications. Nowadays, Latin has slowly gone nowadays, but we have to use that in the prescription. Use that symbol in the prescription. This is if the prescription is to be legal only if it is complete all these requirements. Thank you.